Welcome back to my channel. I am here to help you improve your health to live a good life.
Hi everyone, my name is Zonna. I'm a physical therapist from Orange County, California, and you're watching my channel, Zonna Physical Therapy.
Today I'm going to discuss ankle and foot fracture. What slows down the healing and how long does it take to recover? If you're someone who just had a surgery on your foot and ankle, this might be a good video for you. You would need at least 6 weeks of physical therapy and sometimes even longer if prior to your injury or surgery you were not very active and you don't exercise much. And for some people that are active, they have good muscle tone and they live a healthy lifestyle, mostly they would be the one to heal first. If you have diabetes, it usually takes longer for the bone to heal, and as well as if you are a smoker, because nicotine actually vasoconstrict your blood vessels, and so the blood cannot easily pass through the vessels. It decreases the space inside your blood vessels. Very bad for the circulation. You will have more trouble in recovery because the nutrients that flows through your blood to go to your bone for healing usually have difficulty and takes longer to get there. It also depends on which bone and which parts of the bone that was broken. Just like the calcaneus takes longer time to heal. Usually you start with non-weight bearing, then after a few days they would advance you for a toe touch or partial weight bearing depending on the result of your x-ray, and they usually would run the film before they change your weight bearing status. And some doctors would allow toe touch weight bearing, but I normally don't use that toe touch weight bearing because it is a very risky, and for the most part most patients, even if you tell them toe touch, there's tendency and there's a higher risk for them to actually put more weight than just toe touch. I'd rather keep them on a non-weight bearing status, and then when they're allowed to put 25%, then that's when I would let my patient walk at a 25% weight bearing and then go up to 50% partial weight bearing until you reach the full weight bearing, which could at least take you 6 weeks. And for calcaneal fracture, usually we recommend 3 months because it takes longer to heal. It's very important to follow your weight bearing status because you have a risk to re-injure the bone and possibly go back and redo the surgery. So you don't want to go against that. And make sure you work with your physical therapist because they're a very special kind of doctors that is very knowledgeable with functional anatomy. There are a lot of exercise that your physical therapist could guide you with, especially in the beginning. Non-weight bearing exercise, range of motion exercise, stretching, and all the likes. Make sure don't miss your physical therapy visit, especially in the early stages of your healing. Some of you might think that you don't need to see a physical therapist until you're allowed to put full weights and able to walk on that leg. But however, I would recommend that you see them right after your surgery, especially on the early stages, because it's easy for you to be deconditioned and to lose a lot of strength and endurance because you could be missing out a lot. Physical therapy is very important to make sure that you're in the right path of your recovery, and they will help you and guide you on this. And some people even see their physical therapist prior to surgery to learn what are the exercises that they are expecting to do after the surgery. And if you already know what to do beforehand, it will be easier to put it together after you had your surgery when you're having a lot of pain. And a lot of fractures doesn't even end up in surgery. They could fully recover without even surgery, especially if the fracture is very minimal. So sometimes working with physical therapy to help and guide you recover while your bone is healing would be a good thing to do. I hope that these tips are very helpful with your recovery in whatever stage you are right now, and I hope that you will share this video if you know someone that is in this situation. I would love for you to share it to them, and hopefully you'd support my channel. And I'm very glad that I'm able to make this video in order to help you out. I hope that you could give the love back Please like, subscribe, and share my videos. I thank you so much for your support and your time. I cannot wait to see you on the next one. Take care always and stay healthy.